Hi, I'm Paulette from Tridente, and I just wanted to talk to you today about the Beyond in-chair whitening system. So I've been using the Beyond system in my dental hygiene and teeth whitening studio since 2014. It's fabulous. It's easy to use, minimal to no sensitivity. It's really cost effective, and it's a really good quality USA made product that has won Dental Advisor Awards for about 11 years in a row now. So it's a great product to incorporate into your teeth whitening services. The thing about the Beyond is, well, I'll just go through the kit step by step. So it comes in a pack of 5. You can get a sample kit of a single system, which is also available if you just wanted to try it first. So each pack has a tube of barrier resin, a tube of gel, times 5. So there's enough in a pack for 5 in-chair services. And in actual fact, if you are whitening 2 or 3 clients in a day, or if you have whitening days put aside in the practice, there's a little seal that you can put back on the tube of gel, which means that 1 tube of gel, there's enough whitening gel in here to do 2 complete client cycles. So that makes the system really cost effective. So a box of Beyond is $460. That's for the standard 5 syringes with the barrier resin, the face cloths. Comes with a little take-home shade guide and client instructions, enough for 5. But if you wanted to get more value out of the system, you can use 1 syringe times 2, which brings your per patient cost of the in-chair whitening system down to $45. So I'd like to kind of think that's probably the most cost-effective in-chair whitening system available in Australia. That's a quality USA made gel, and it's a 35% hydrogen peroxide. So I'm just gonna do a little demo of how to set up the system. And then I will, you probably can't talk while I'm doing it, so I'm just gonna do it and then I'll show you. So I'll talk first. How confusing. Retraction. This is my favorite retraction. The thing about using an Optigate for teeth whitening is that there's nothing for the clients to bite on. So basically, when they're closed on their posterior tooth, it means that the portion of the lower teeth is always going to be covered by the upper teeth. And so therefore, how are you going to apply the gel close to the incisal edges of those lower incisors? Plus, the client doesn't know where to rest, what kind of comfortable position to rest into. And it also leads to the risk of the client poking their tongue forward and licking the gel off their teeth. So I like a retraction system which has a tongue block here, wings that the customer can comfortably bite down onto, which keeps their teeth separated by about 5 mil. It's got nice soft channels here for the lips on the sides. It's flexible, so you can use it for a variety of, someone with a small mouth opening or a bigger mouth opening. It works in all situations. Don't get me wrong, I do love Optigate. I use it for hygiene appointments often when I'm using the ultrasonic, but for whitening, I believe that you need a lot more kind of safety in place. So the wings to bite on and the tongue blocking area is going to be super. Then there's a face cloth that sits over the top of it. And then all you need to do is add in 2 cotton wool rolls down into the buccal aspect there to absorb any saliva. And then you start to place the barrier resin. So it's a really quick prep and really simple. So I'm just going to do it and show you. So the idea is that you squeeze the retractor together. I'll hit in like that. Face cloth on, clip it around. Like that. Tuck these under. Perfect. That's excellent. And then just get cotton roll, tweezers, cut it in half, one goes in here, tuck it in, and tuck it in,
That's it. Simple. You don't need anything all tucked up in here. There's no need for any of that. The only other thing, there's someone's got a jig lift here. You can just moisten some gauze. Like that. And just tuck it over the lip and under, and under, and that height, that if I was lying down, that would be alright. Yeah, like that. Cut up, sorry. Cool. That's it. Alright, so I'm going to take it out.
You can see it's a really simple prep. The safety part of it is easy, it's quick, and it doesn't involve a lot of time to get that set up. The barrier resin is amazing. So I like to use, when I'm applying barrier resin, I like to do 2 passes. So the first one is with a fine tip. So I draw like a fine liner outline along all the scalloped gingiva, fill in any areas where there may be a gap between the teeth, cover any exposed dentine where there's some recession. So like for example here I've got some recession, so I'd need to just cover that over with barrier resin, and then apply the fine line to outline and connect and cover the gingiva so it's really well sealed. And then I go back in with a slightly wider tip and then just backfill it for 2 to 3 millimeters. I'll add a photo. You'll be able to see a pic in a minute when I add it to the video. So then the cure of that, so just remember when you're curing barrier resin, it's important just to keep the curing light moving slightly. You don't want to hold it in place in one spot for too long because the resin can overheat. So you just want to, and that's with all resins generally. So you just want to just gently move it from side to side, really just to cure the resin. I generally do to the distals of the 5s and to the mesials of the 6s if I can reach, but honestly, I don't know, people don't really see that far back. So distals of the 5 is a good one to aim for. When I'm putting the barrier resin at the distal of the 5, I like to just put like a little speed hump. One of my gorgeous students named it. So it's just like a little kind of blocker at the back. So in the event that the gel warms up and starts to move a little bit, it doesn't start to flow backwards. So I just kind of build up the barrier resin as a little block at the back, but I can go through that in more detail with you. And then it's super simple with the gel. It's just mixed, like it's got a little mixing tip. Attach the tip, I bleed it for about half a centimetre, just a couple of mils. And then when you're applying it to the teeth, so it's just sweeping it, sorry, with the tip on there, sweeping it across the tooth so that you're covering the tooth surface nicely. You're just putting a thin layer, so it's about 1 millimetre thick on each tooth. And it's for the Beyond system. On average, it's 3 cycles of 10 minutes. So you can leave it less or leave it more, but 3 cycles of 10 minutes is a good amount of time. It's the recommended kind of protocol for it. And then I do activate it with my handy dandy whitening lamp, which you may or may not be able to see. But, so I've actually got the Beyond Polis lamp, which is amazing. But I do also sell other types of teeth whitening lamps. So this has got like a, oh, I've unplugged it. But anyway, it's got like a really nice kind of flexible and head on it. So you can really move it easily into position around the client. And so people go, well, you don't really need a light. You know, there's no discernible, the clinical studies kind of show there's no discernible difference. The thing is, that's what the customer wants. They're seeing lights on Instagram and social media. So if you're offering teeth whitening services and you don't have a light, they're going to be disappointed because the beauty salon down the road does have a light. So it's more of a marketing perception that you need to kind of go with what everyone else is seeing online, basically. So I do use a light. Some of the newer lights have ultrasonic technology, which are actually, showing some evidence that really does make a big difference. And I do have more information about those if you're interested. So that's a new kind of more modern style of whitening lamp that is now currently available in Australia. And so, 3 cycles of 10 minutes, use the light because that's what people want. And also, you need to talk in terms of what people are seeing online. So you can't make claims. You can't ask anyone selling a whitening, any sales rep selling a teeth whitening product, how many shades lighter will your product get my customer's teeth? Like, that's not a question. Because what's the start colour? Is it shades of brown and yellow? Is it shades of grey? What's going on with the teeth? The age of the person. There's so many things to take into consideration. So you can't actually predict. So if you ring me up and you go, tell me how many shades lighter does your product get for my client? I'm going to go, well, I don't know, because you'll get results, but I don't know if it's going to be 1 shade or 3 shades or 5 shades, because you don't know until you're actually got the client in front of you, you've applied the gel and you've come out the other side, and that's when you know how many shades lighter the gel, has made a difference for their teeth colour. Who's using one of these? These are important. It's a cosmetic shade guide versus a Vita shade guide. So firstly, you need to have your Vita shade guide in order of colour from lightest to darkest. So you need to change it up, and that's on my website as to how to do that. But these go up in half shades and these go up in single shades. So for example, if you went from, A3 to A1, it might be 4 shades on here because of the way it's set up. But on here, it's going to be 8 to 10 shades. So it sounds better. So all of a sudden, your clients are getting a result that's 8 to 10 shades lighter. It's just marketing. It's not a real thing. But the customers, that's what they're seeing on social media. So that's what the beauty salons are doing. So when you look at a beauty salon and they're advertising, come to me, you'll get 12 shades lighter, I'm using 6% hydrogen peroxide. We're all sitting back going, how on earth are they doing that? Well, firstly, they've got an amazing business because of the marketing and because they're offering a service that we're not. So think about that for a minute. Why are beauty salons so busy doing teeth whitening? Why are we concerned about all that competition out there? And why are they so busy? It's because we're not offering what the customer wants. So you need to rethink your whitening services in your practice. So this shade guide is going to help you more so than this one. So I'm just giving you some little, tips and tricks about whitening services. My other thing is, if you're using a whitening lamp, you need to be able to use that for a variety of teeth whitening services. You can't be locked in to one teeth whitening service, because you might want to do an express whitening in the chair. Well, you're not going to open an expensive packet of teeth whitening gel just to get the connector out to activate the lamp to do 1 cycle of whitening to give them a $99 express whitening in your lunch hour. You're not doing that. So you need to go, all right, I need a lamp that I can use for a variety of whitening gels and provide levels of different services or different levels of services in my practice. So for example, I offer my clients a cosmetic whitening service or an express whitening after each hygiene appointment. So it's 15 minutes of whitening. It's a light active gel with a photo initiator in it. Still needs a barrier because it's middle strength whitening gel. It's a carbamide peroxide. Brilliant results. Amazing. But if I was locked into using a lamp that needed a connector, I couldn't offer that service. So next minute, that customer who only wants to pay $99 for an express whitening service is going to go to the beauty salon down the road, but now no longer your customer. You lost them out the door because you weren't able to be flexible with the whitening services you can offer. I also offer whitening kits for take home. And I offer custom whitening trays. So all of a sudden, I'm building out this beautiful menu of whitening services that's using professional gels, but I'm offering different price points. So for example, you can have your platinum in-chair whitening service. You can have custom trays with take-home gels. You can have a take-home whitening kit that they can use, or you can do an express whitening service in the chair. So many more options. All of a sudden, the customers are going to, say yes to the whitening you've got because it's something that works for them. You're not going to lose them out the door because it's too expensive or untenable for them to, justify to have that service done. So the other thing that I'd wanted to say, Beyond Whitening Gel is brilliant for in-chair whitening. I do have a variety of different whitening gels that I offer, and I'm going to talk about those in another video. Thank you for hanging in there for so long. And if you've got any questions, just, how to get in touch. Okay, see ya, bye.